Sarah, can you hear me?
I can hear you. Can you hear me
Oh,
okay?
perfect. Yep, I got you right there.
Awesome.
So my name's Trapper. It's good to meet you.
You as
I
well.
saw you on the meeting, but it's good to formally meet you.
Yes, you as well.
Um, so this is my podcast. It's Rolled 740 Inc. It's very new. I'm very new to doing this, but really informal and just want to talk about GBS or CIDP, Miller Fisher, whatever questions you have. I apologize. I was on the phone with one of the gentlemen from that meeting that we were just on. That what was it? It's a GBS CIDP. Is that the awareness meeting?
That was the coffee
International.
chat. Yeah, that
Mm-hmm.
was the coffee chat that they try to do every month.
Yeah,
Um,
yeah, that was
I'm
good.
yeah, no, it was good. It's good to hear people share their stories, and especially to just not feel like you're alone in this. Because I did actually hear a few people that, just explain
Can you hear
how,
me? Okay, I think I lost you for a second
uh-oh,
there.
oh, yeah, I can hear you.
There you,
Sorry.
there you go. No, no, no worries.
It's probably this
So,
Buffalo, New York
yeah.
weather.
Oh, we have the same right here at the moment. Anyway,
Oh, I
it's
heard.
it's raining and
Yeah.
it's windy.
Oh, I
Yeah.
heard that. That's terrible. Yeah,
So I
no,
kind of like it.
you do?
I do. I lived in Portland, Oregon for a few years, so I
Okay.
kind of miss the weather and the rain.
Okay, gotcha.
But that coffee chat was really good, and
Yeah,
I think what came out of it, what I got out of it, was there's more people dealing with this than you think, right? Like
absolutely.
for me anyway, you hear just how rare it is, but and that may be true, with GBS, they say 1 out of 100,000 get it.
Yeah.
With the Miller Fisher variant, it's 1 out of 1 million.
Hmm.
With this other variant that I have, there is no number. They're calling it like 1 out of 1 billion, but
Wow.
whatever it is, it seems to be increasing.
Yeah.
It seems like more and more people are getting it. I don't know if that has to do with the vaccine and or COVID. Like, I have a case study here that Loma Linda did on me. It's not published, but it's like the sign over authorization to publish it
Okay.
paperwork. And it's interesting. And in there, they talk about it being as a result of COVID.
Hmm.
So they're still learning. We're still writing the book. There's a lot to learn about this thing.
Oh, yeah.
Even, the doctors in the textbooks, they don't have the answers.
Oh,
So
I lost you for a
it's
second.
this kind of thing, talking to patients,
Uh-oh.
patient to patient, I think, and or
There you
family
are.
members of patients is really beneficial. So that's what I'm trying to do. And, after we got off that coffee chat meeting, one of the guys called me immediately because I put my number up there, and he's dealing with the same thing I dealt with his dad. He can't get answers. He's
Yeah.
not at a level 1 trauma center. It's that old. Send him to a long-term nursing facility, give him PT and hope he gets better.
Yeah.
IVIG treatment didn't work, so let's
Yeah.
just see what happens. But
Yeah.
anyway, Sarah, I'm like, what's your deal? What's your story, or how can I help you in any way that I can?
Man, I mean, just talking about it, for one, is helpful to know that somebody else is, again, and I always hate saying it like this, but, I like knowing that there's somebody out there just dealing with the same thing you're going through, just to feel like you're not alone. And
Yeah, yeah,
as
for
much as
sure.
yeah, and you don't want anybody to be experiencing what we are, but it makes you just feel like, okay, there's other people that are feeling these same like stressors, the same, like when you were saying pushing every day, like that got me.
Yeah,
I immediately started like tearing up because I'm like, that is what I say every day, is like, you wake up, it's a different day every day, and you just got to push. And that's, you have to really be in a good mental state to get to that point, where you're more focused on like, okay, every day I need to get better. What do I do to get there? And I think a lot for me was, I didn't know how to get there. it
hmm
it I wasn't getting answers. I felt like when I was diagnosed in August of 2021 that I was there. I got the IVIG treatment, and I thought I was going to be 100% better, and that didn't
Yeah.
happen. And I can remember the doctor even saying, it's an 80% chance that you will be completely restored. Weird word to use, but restored. And
Hmm.
I was more of, well, what about that other 20%? What happens if I'm
Yeah. What
not?
happens to them? What happens to me if I'm
Yep.
that,
Yeah, and that was where I had that, pit in my stomach that I knew, okay, there's 20% chance this might not work. And where do you go from there? And I felt like once I was released from the hospital that I was kind of on my own, and I had to figure out
Yeah.
my path from here. And I was given, a neurologist, and they appointed certain people that they wanted me to go see, but I just felt like they were like, okay, you have GBS, you might get better at this time, and you might get better at this time, and I was just like, I would prefer doctors to not say that, because then
Yeah.
you're holding on to that, okay, in 8 months I will be better, just as an
Yeah,
example. And
absolutely.
yeah, and then it's like, okay, 8 months comes and you're like, what am I doing wrong? I'm not feeling better. I'm still having trouble moving. I can't do the things that I normally did. So what now? And for me, I mean, I went through three different neurologists. And I mean, right now I have somebody that is just God sent to me, because he's just been so amazing, and really listens and really wants to help.
Hmm.
And, where I had a neurologist that told me, if you're not ready, or if you're not, I'm sorry, healed by January of 2023, here we are. He's like, you're going to live with it for the rest of your life. And, that to
Yeah.
me is like, that's the last thing I want to hear. And this is a professional that, is supposed to be really looking out for you. And I felt like I wasn't, and it definitely, I'll say, it gets lonely. You really do feel like,
Yeah.
you just have to, like I said, every day, just try to keep it together and move forward.
Absolutely. I think you nailed that on the head, and I remember thinking, those same things, like, that 80%, and
Yeah.
those, kind of timelines, of where you'll be and when. And I mean, I remember when I was first in the hospital, my wife and I were in the ER being admitted. I thought I had a stroke, my body's not working, what's wrong with me, kind of deal. And one of the neurologists came over that happened to be there right away. And he's like, it sounds like this thing, without testing, we won't know, but
Yeah.
it sounds like this thing, GBS, right? And we need to get you started on treatment tonight. And he was super awesome, and he was a part of my journey, and in some of the surgeries and treatments that I was in. And I remember the nurse that first checked us in, she was like, I'm so sorry. Just keep in mind that this is a very long and slow journey. And she's like, don't Google it. Don't look it up.
Yep.
Talk to other people. Talk to other
Yep.
patients, talk to family members. And so what did we do? We Googled it immediately.
Yep. Exactly.
We're in the ER waiting
That's
room.
what
And
we
as
do,
you know,
What's
nothing
wrong with
fast
Google?
happens in the hospital. It's very, very slow moving,
Exactly.
no matter what you're doing. So we Googled it, right? And we found out what we could, and man, is it slow.
Yeah.
I remember I was fully paralyzed head to toe in a locked in state, eyes paralyzed, full trach, peg tube, the works, keeping me alive. And but I could still hear. I never lost that.
Thank God. Yeah, that's
And
terrifying.
after all the treatments, 2 sessions of 5-day IVIGs
Yeah.
didn't work, and 3 separate, treatment 4-day sessions of plex or plasmapheresis with only declining, nothing was working until we found and connected all these people across the country. And, until we did this testing for this, neurofascin 155 antibody. And until that happened, I didn't get the proper treatment or diagnosis.
Wow.
So I have acute severe CIDP, with like a cross variant that they don't really have a name for. And it hit me so hard and so fast. They'd never seen anything like it. And that's why they're doing the case study, because it's new to them. Wow. And they're a level 1 trauma center out here. Like, if you get fucked up out here, like, you want to go to Loma Linda, it's a top tier medical center and learning center and hospital and part of the university. But even them, they were like, they threw their hands up. They're like,
oh God,
we're gonna watch and see what happens, kind of deal. And before I lost the power to speak, I was like, that's not good enough. Like, keep trying something.
Yeah.
Give me a treatment. I don't care if it's in the books or not. Keep going.
Do something. Yeah.
And do something. And thank God my wife was by my side and kept pushing and kept advocating for me. And that's what I was telling this guy Frank right now. Keep pushing for your dad. Keep asking questions.
Yeah.
Keep asking for tests. Keep asking for treatments, no matter what they may be. Mm-hmm. And I ended up getting a chemotherapy treatment for non-Hodgkin lymphoma.
Oh my gosh!
Like, that's what saved my life, and it still does. So like, I battle with it, and my shit never goes away. Every 3 months I get this, chemo. It's labeled like chemo number 6 or some shit.
Now,
but
and I don't mean to interrupt you. I'm sorry. Now,
no, go ahead.
That type of treatment, like, what exactly is it? Is it like an injection? Is it like an infusion you have to go through? Okay. It's not
an infusion like IVIG where they're giving me plasma. It's actually, and it's an IV, and it takes like, between 6 to 8 hours.
Okay.
1 day, every 3 months. And like I said, we're still writing the book on it. Like, at first when they gave me the treatment, it started to work. I started to be able to open one eye. And as this thing moves super slow, as I'm sure then I could move like my left thumb a few days later. Then a week later, I could move my right toes. It's like, that's how slow this thing comes back.
You're absolutely right.
And they told me, you're not going to be the same. You're not going to do what you used to do. And to me, I was like, I have to get back to work. I have shit to do.
Exactly. Yeah. It's like, you're like, no, I don't have time for this. Like, I don't.
Nobody makes. Yeah, nobody makes time for this. You don't plan that you're going to get sick, and it to even, to go back to what you said as far as like timeline and, pushing yourself and getting better. And like, even after PT and OT, and I still go to outpatient PT, and, I'm a year in. This whole thing started exactly a year ago next week.
January. Yeah.
Yeah. And I went from, fully paralyzed and locked in state to now I walk with a cane and I drive around.
That's amazing.
And they told me that was never going to happen again. And I was just like, pardon my language, but fuck you.
Yeah.
I got shit to do.
Yeah. Yeah.
And I'm still not back to work. And it's hard because I want to do things. I want to be the old me. And, and my wife checks me sometimes and she's like, babe, you live with this for life. This is part of your life now. And that hit me hard. It wasn't like, you're sick, take your medicine, you're going to heal, then you'll get back to life, right? Yeah, you're just like, this is part of your life now. And it is. And that was hard for me to grasp. And that hit me hard when I heard it out loud, you know, and I'm still like, I don't care. I got shit to do. You know, I didn't come out as grateful and as thankful as I should be. I came out angry,
Yes.
actually.
Oh, wow.
You know?
Yes.
Just like super
Oh
angry
my
that I
God.
even
Okay.
had to deal with this. And I even had to, I was at everyone's will, you know, like roll me over, wipe my ass,
Yep.
wipe me down in my, you know, my bath time at night. Like
Yep.
every single thing, I was at the mercy of other people.
Yep. You lose
And that was hard.
all of your
You
independence.
lose everything, your independence, your dignity, you know, my pride went out the window. Like I got really angry about it, and I'm working on letting that go.
Yeah.
And still working on helping other people. That's what I have to focus on.
Yeah.
Other people that didn't get the answers that we did,
Yeah.
or didn't even know the questions to ask in this.
Yeah.
You know?
Exactly. And that's
what it's
what,
about for me.
yeah. And I feel like, I mean, because I was diagnosed, like I said, in August 2021, and because I never even heard of it, I had no clue. I mean, I couldn't even pronounce it at the time. You know, there was one point I
Same here.
remember, yeah, but I remember telling the doctor, "Can you write that on like the whiteboard, you know, in the hospital?" And like what it is, because
Yeah.
you know, he also had an accent. So, and I'm sure you can tell I have an accent. So it was even harder. I'm like, what is it? You know, and again, like you said, I Googled it and it didn't sink in. When I was
Mm.
in the hospital, like, well, I'll go back a little ways. So back in May of 2021, I started, and it's weird looking at it now because I had no clue what was going on, but now I'm like, oh my gosh, like, why didn't you think that was a problem and ask for help? But I started having issues with my face, and I started like around my mouth and like my tongue, it just felt numb. And I didn't know why.
Mm-hmm.
And like if I tried to yawn, it would hurt. And for me, I was just like, okay, maybe I'm going through something. I don't have time for this. You know, it was more
Yeah.
like, okay, this will go away. And it didn't. And it like, I would say that more of like my cheek muscles started to get numb as well. And again,
I
I
lost you
ignored
there,
it.
Sarah.
I figured it'll
Cut out
go
for a
away.
sec.
And come June, I just remember I started feeling a little sick, and I didn't know why. Nothing extreme, but just no appetite, you know, not interested, which I was like, well, great. You know, summer's coming, you know, I don't have an
Yeah.
appetite. I'll lose some weight. And, you know, once end of June to the beginning of July happened, I remember I missed the 4th of July, and we were supposed
Mhm.
to go somewhere, and I couldn't move. I ended up having to sleep downstairs because
Yeah.
I was starting to, you know, it started at my feet like everybody, and it was like one of those, it felt like I just wanted to scrunch my toes and that would make it
Mm-hmm.
go away. And it was slowly moving up my legs, and then I was having issues walking. And, you know, I'm like, okay, I'm going to buy a cane from Amazon. So I bought a cane. You know, I'm like, I still want to keep going. I still want to do stuff.
Yeah.
And I pushed, and, you know, and I was just like, I still was like, what is happening? You know, I can't go upstairs. And, you know, it's like, why can't I do
Yeah.
stairs all of a sudden? And, you know, and then, I mean, it was like I started losing control of my bowels because it was
Yeah.
going up so much that I didn't know what was going on. I mean, I would wet myself in the middle of the night and have no idea. And so then that
Yeah.
became even more of a situation where I had to be close to the bathroom because, you know, I got to wobble my way with my cane to get there in time,
Yeah.
you know, to make it. And there were a lot of times that I didn't. And there, you know, in 2021, there was still a lot of like talk of COVID, and, you know, the last place you
Yeah.
wanted to
Sure.
go was the hospital, you know.
Oh yeah.
Oh yeah.
Yeah. Yeah.
That was like, no.
I didn't want to go.
Yeah, I was the same. I was like, nope, I don't want to do this. You know, my husband kept pushing me like, you need to go to the doctor. And I reached out to my doctor. My primary wasn't helpful. They
Same.
tried, they tried to give me medication. It didn't help. And then it finally hit me back like in end of July, early August, when my left arm started going numb. So I felt it. I woke up at 4 in the morning and I was like, you know what? I'm gonna like clean up the house and get going and get my day ready. And I was really having a problem and I didn't know what it was. And I was just like, whatever, I'll ignore it, like everything when it came health wise for me.
Yep.
And so I went and I laid back down and I was like, my left arm is not moving. And I could slowly feel it like going up to my shoulders. And I started to really get nervous because my father suffered 5 heart attacks and like he has a defibrillator.
Wow.
So right then and there, I'm like, okay, this is not good. And, I called I pushed back for my husband. I was like, I do not want to go to the hospital. I'm going to call my doctor when they open and see what they say. So, I called them and I told them exactly what was going on. And they said, you need to go to the emergency room. And I was just like, shit. I'm like, that was
I
what I
really
was.
don't want to go there.
Exactly. I was just like, please do not make me go. I'm like, I'm going to get sick going there. And they're like, no,
Yep.
they have really good protocols. Just, you have to go. So, very long story short, once I was wheeled in, to the hospital, I remember there were a ton of people in the waiting room. There had to be 25 people waiting and they wheeled me back, right away.
Right?
Yeah.
They bypassed, same here. They bypassed
Yes.
all those people that were waiting
Right.
for hours. They're like, you need to go back right now.
Everybody's looking at you like, who do you think
And
you
that's
are?
even more scary.
Yeah. And you're like, I'm sorry. I don't know what's happening. And so they wheeled me back and I'll never forget this woman. She was checking me and, getting all the information she needed. And I'm a very like, laugh person. Like if I'm uncomfortable, I'll laugh or, I try to get humor into things so that it's not as bad. And she just looked at me dead straight. It was like through my soul and said, honey, this is very serious and you need to start taking it seriously. And I just like was so taken back and didn't know what to say. And I just go, well, what's wrong with me? I was like, aren't you going to just give me a shot and I'll be fine? And,
right.
We'll be
I'll go
done.
home and get better. Yeah.
Exactly. And I was just like, I thought I was going to be in and out. And, they took me right back to one of the the ER rooms. And I was in there, I felt like forever. And I just remember sitting there and I felt like an animal in the zoo. Like all of a sudden it was just like every doctor, every intern was coming into my room at one time. I mean, there'd be 5 people in this little tiny room and they're asking me all these questions. And it was like, they wanted to learn from me. And I didn't realize that at the time that they're like, probably like, this is a very rare case. Like you need to see this, as students coming in. But for me, I'm like, stop doing this. Like, help me and get me out of here.
Exactly.
And, I'm like, I don't want to keep talking about this and doing, them taking a thing and hitting my knees to see if my leg moves and all that. And, it was constant. And I just remember being like, when are you going to get me out of here? And that's when it started. Like, it turned into, you're staying overnight. We're going to have to put you up on a floor. And I was just like, what is going on? And they did do the spinal tap to me in the hospital, which was by far probably one of the worst things I've ever experienced.
Right. That sucks, doesn't it?
Oh my God. When you can't move your body and they're like, crunch up in a ball, over a table and lean back while I take this needle, and I'm like, what? And I just remember sitting there and trying not to scream because it hurt so bad just to have my body, confined like that.
Yeah.
And I just remember the guy being the nurse, and he's like, okay, are you ready? And he was talking to an intern or something, and I thought they were done. And I was already, because I'm just yelling in pain, for what the normal pain that's coming on from GBS. And he's like, I haven't even touched you yet. And I'm like, oh my God, just get me out of here, please. And it ended up, I was there in the ER for 2 days and they finally put me up to a floor. And I felt almost embarrassed a little bit because a lot of the nurses coming in were so happy to talk to me. And one of them finally said that we love coming in here and having a conversation because you're the only person that is your age on this floor.
Mm-hmm.
And a lot of the other people, you know, are in their 70s, 80s, and they're like, we've never dealt with something like this. So it's nice to be able to talk to somebody that's our age. And I was just kind of taken back. You know, I'm like, oh,
Yeah,
okay.
like, great. I'm
And
glad for you, but
what's that?
hey, you're like, I'm glad for you,
Yeah.
but
I'm happy
it
for
sucks
you,
for
but
me.
I still love
Yeah.
you. And I mean, they did MRIs after MRIs and
Yeah.
another MRI, and like, I'm claustrophobic, so you can imagine how that
Yeah.
is.
Same here.
Oh my God. And they'd be like, yeah, you got to go for another MRI. And I'm just sitting there like, please don't do this to me again. You know, and they're like, it's only going to be 2 hours. I'm like,
Yeah.
only, huh?
Uh-huh.
So, you know, that when I was up in the room, I mean, I have to say I did have good treatment, but again, the IVIG and the doctor that said, you know, you're going to be great. I just wish that I could see him and say, please don't ever tell somebody
Yeah.
ever tell somebody something that you're not 100% on. And that,
Right.
oh, there you are. But you know,
I feel like only another patient should be able to talk to other patients. Unless a doctor has had it, you just don't know.
yeah,
You don't understand.
I totally
You can't
agree.
possibly. And like you said, at the hospital I was at is a teaching hospital.
Oh goodness.
And I get that, you know, and I mean, first getting checked in ER, they hit, and I'm a hard stick. My veins roll already, and they're hard to find. Already I kind of jacked myself because I have tattoos. So they're like, oh, we can't see, you know? And then they're sticking me over and over, and like, I have a hard time. I have tattoos, but I have a hard time with needles.
Me too.
Inside my veins is a problem. And they're sitting there, this guy's jabbing me like 4 or 5 times, and I'm like, I'm gonna pass out. I start sweating instantly. I'm like, oh my, I get all dizzy. You know, my wife's trying to cool me off, and after like a while, I was like to the nurse, I was like, look, I understand this is a teaching hospital, but can you please do this?
Yeah.
I'm having a hard time here. Like, yeah. I know they need to learn, but can they learn on someone else? I'm having a really hard time. And then, like you said, when it, you know, come lumbar puncture or spinal tap time, I had several of those. And same thing, I'm crunched over and I'm just in pain already. And I mean, they numb you, right?
Yep.
But still, once they get in there, they're hitting nerves straight off your spinal cord. And that hurts. And that jacked me up. And my back hasn't been the same since. It's just not right. It hurts a lot. And if I bend over and hit a certain spot, it hurts instantly. And I can't deal with it. And again, teaching hospital. So just like you said, and I didn't know this till afterwards. My wife is watching it happen. They allowed her to be in there for a lot of stuff. And they're watching me and stab me like 4 or 5 times and they can't get it. And it's like 30 minutes later. And I'm like, are you guys done yet? And like, they're like, no, you know, do you want to try this? So they finally switch out to, they're doctors, but they're brand new doctors, you know? And so it's like, give it to somebody who's done this before.
Right.
And then, you know, then they hit it, get the fluid they need and all that. And then later on, the other ones that they did, I was out for, or I was in a coma for, so I didn't feel it, you know, till later.
Yeah.
But, and then, you know, again, you know, to go back to how you feel about MRIs, this was a big deal for me. I mean, I used to work outdoors. I would work in attics and underneath sub areas in a home. Not a problem. But this kind of area that's like, so close, like they strap and now mind you, at this point, I'm fully paralyzed except my face. I can communicate with my eyes, you know, and they strap me down. They put this like Hannibal Lecter, like face mask that straps me, you know, to the back of the slide
yeah, you're
thing.
Like pretty much like a tube thing, or not a tube, a foam thing behind your head. That's like,
to keep your head. Yeah. Exactly. And I remember like, I've had anxiety since I was 20. So like 20, 21 years, you know, I take Xanax regularly, I've taken all the meds, seen all the, psychiatrists, all the bullshit, right? But Xanax is the only thing that ever worked for me.
Yeah.
I don't have depression. My heart just races for no
Yeah.
reason. Heart monitors. I've seen everyone, right? Xanax is the only thing that works for me. I like that you have a Buffalo Bills cup, by the way.
I got the shirt.
It reminds me of a movie, Buffalo 66.
Got my boys.
But so even though I take Xanax, I'm sort of not immune to it, but if I'm going to go into a procedure like that, I need you to dose me up good.
Yeah.
And, and they're giving me IVs of Ativan, and it's not quite equal of the milligram to milligram. It's not working. I know because I tried that too, and it just doesn't work like the Xanax does for me. So,
yeah.
And they're like, I'm like, look, we have to like quarterback this thing. I need 2 milligrams of Xanax 30 minutes prior to the procedure. And I need you to hit me with that 0.5 of Ativan in the IV on the way down.
Yeah.
And so they have to get approval from everyone, right? Like get approval, blah, blah, blah. Yeah, it works. Yes, they're ready in the MRI room. Everything's good to go. And then transport comes and gets me, and they're like, okay, we have another oral 1 milligram to give you. And my wife's like, make sure you give it to him. Like, it's the only way we could do the MRI. And the guy's like, yeah, I'll give it to him if he needs. Well, they take me down. It's already checked out to me. He pocketed that shit and never gave it to me.
Oh, no.
So I'm in there, and they're strapping my face down, and I'm tripping. I'm like, I can't handle this for 3 hours. And it's like, NCIS, I don't know if you've ever seen that show, but it's like Abby's lab in there. Like it's this girl all by herself. She's rocking like this, like punk metal EDC cross music. And it's just terrifying for me. And she's like, oh, I should turn the mic on in case you want to talk to me. I was like, yes, please. Please monitor me while I'm in there. Don't just like push the button and go do something. Like, I need you to watch me because I'm going to freak out. And I kept thinking to myself, my wife kept telling me, just get through it. You don't want to do it again.
Exactly.
You just have to get through it. I'm like, yeah, you're right. I don't want to do it again.
And that's what got me as well. And it's funny that you're saying that because I already was prescribed Xanax before going in as well. And, they were like, well, do you want a Xanax? And I was like, are you kidding me? Yes. I'm like, this is like,
yes, I need to.
Yeah. I'm like, please, I need something because I can't be like just them taking me down into the area that they were going to do it. I had to close my eyes because I didn't even want to see the machine to know what it looks like and know that I would be inside of it. And luckily I had this wonderful woman that I told her, I'm like, I need something. Like the Xanax is not doing enough, but I want to like get in and out. Like I want to do this as quickly as possible. And she told me, she's like, you know what? You got your Xanax and stuff, but she goes, if you need more, it's going to delay the time. So it's going to make you in there even longer. And I was just like, oh God. Okay. So when they put me in, the whole time, all I was thinking was that there was an exit where my head was. And all I thought was, if I have to get out of here, I am pushing my body some way. I don't care how, and crawling out, like one of that horror movie I can't think of where the girl like walks backwards. I'm like, that'll be me walking backwards, scaring these people because I will do anything to get out. And, I remember being in there and she really did talk to me and talk me through it. But anytime I heard like that wheel go around me, it was just like, I had to think about something else. And again, they'd be like, stop moving. Yeah. And I'm like, I can't not move. I don't even know what I'm moving. I'm like, if I am, I'm sorry. It's not me doing it, And she's like, your toes are, going all over the place. I'm like, oh, okay. And so it really, it was a horrible experience. And then to do it again, it was just like, it felt like it was never going to stop. And, and then just kind of going back on, my whole path with this was, after the IVIG, I actually, when they, got me out of the hospital and I came home, I started swelling up. and my legs were swelling, and
Yep.
I didn't know what was going on. And I happened to have, yep,
Ankles,
the
feet,
whole thing. They were
hands,
like,
all
wrap
that
your
for me.
legs. Yeah, wrap your legs up. And I did it every day. I like, elevated my legs and stuff. And it wasn't getting better. And I remember, it was my stepmother that came over, and she was like just helping clean the house and, being there for me as company. And she looked at my legs and she said, Sarah, that does not look right. And I go, yeah, I don't know. And she
Hmm.
goes, that looks really bad. You need to call a doctor. So lo and behold, I did. And I had to have surgery where they pulled out numerous blood clots from my left leg. And it was unbelievable. The doctor actually, because he allowed me to have my cell phone with me, which was kind of funny, but he took a picture of it because I said, I don't want to see it. I'll freak out. I'm like, I will freak out if I see it. And he like goes, well, I'm going to take a picture and you can look at it another time, but he's like, this is nothing I've ever seen. And, I'm like, well, where is it coming from? How did this happen? And it ended up being a side effect of giving the IVIG. And I didn't, I'm like, are
Yeah.
you kidding me? This, there's now side effects from the stuff that's supposed to be helping me. And, I
Right.
ended up having to get 3 total surgeries just from that. And, I put in the ICU over, I think I was there for 2 nights, and put on a blood thinner to, for
Yep.
them to monitor me overnight. And that was one of my worst experiences because, I'm in the ICU, and again, the nurses and doctors are like, wow, there's nobody that we can actually talk to that's in here because most of the people are put under, or, are in a coma like stance. And I just remember I was in such severe pain, and a doctor did give me
Yeah.
medication, they put into my IV, and that was the last time that I felt normal. And for me, I'm like, I thank God I don't have an addictive personality, but to know that like that drug was the only
Yeah.
thing that made me feel normal,
Yeah. I
it
understand. You
it
cut out.
almost
You
stays
cut
with
out for a
you
second
because it's
there,
like,
Sarah. But
why can't I get there again? Why can't I feel like that? And I just think I'm like, well, because it's something that I'm sure people get hooked on and get
yeah,
addicted to.
I'm dealing with that too.
Absolutely. Yeah. And it's like, you want to feel normal though. You want to feel like you can walk. I
Yeah.
remember I'm hooked up. I got like this crazy monitor thing next to my left leg. They're telling me I can't move my left leg. Like I need to stay still. And I just wanted to get up and walk because I was like, oh my gosh, that stuff is
Hmm.
just making me want to move around. And they're like, you can't do that. And I was just like, man, I wish I had something like this. And, till then, anything I've been given, it doesn't make me feel normal. It doesn't take me back.
Right.
I still have that pain in my legs. It's just not as bad. And,
Yeah.
I did go through another IVIG process after that. And it was such a headache to even have it administered to me because I did have to get it from home. And I mean,
Hmm.
thankfully it was at home, but there were so many complications just from that. I mean, I had infections from them, just
Yep.
putting the IV, I forget what they call it, but, and that's another thing. GBS brain is definitely a thing. I never thought it was, but
Oh my
it's,
God, my memory is
yes.
shit. I
Oh,
can't.
yeah. There's,
It's a blur a lot of
and
times.
and just hearing you say that, it helps me. I don't want you to feel that way, but it's like,
No, no, I fully
yeah,
understand. I
and
get it.
I
I
can't
get
stand it. Like there's times that I will be like, that, and I'm trying to say a word and it'll be something so simple that it's just like my brain
it.
can't get back to say it. And I'm like, should I
Yeah.
force myself and
Jesus.
yeah, and fight it?
I feel the same way. I hate that you have to deal with that too, but
Yeah.
like it makes me feel better knowing that other people are the same way.
Yeah.
I mean, I've been a salesman for a lot of years in several different industries, and
Me too.
while I got sick, I was I worked for a company, Lux Lighting and Athena Products. We sold nutrients and lighting for the cannabis industry,
Oh, okay.
and like I dealt with some really high end clients and customers all over the world. And, I was on my shit.
That's awesome.
On my game, right? Like 3 screens, like, okay, you need this, blah, blah, blah.
I'm ready.
People are bringing, yeah.
You're at Space Central.
People were coming in, with like 500 racks cash, and like, it was just like a hustling business. And it was super cool to be a part of, and I love it, and I miss it. And I went from that to like, I'll walk in a room or hobble into a room and I can't even remember why I'm in there anymore. I'm like, what the fuck? Why am I even in this room, And so my memory shit, I can't remember anything. Like you said, I mean, there's nothing that makes me feel normal. While I was in the ICU, they had me on fentanyl patches, Norcos, Oxy, Methadone, along with Dilaudid injections. Dilaudid.
And that's what I was given.
Nothing would take the pain away.
Wow.
I could not get the pain to go away. And since I've come out, on Oxy, and then I've gotten that down to Norco 10s, now I'm on Methadone. I'm working my way towards nothing.
Yeah.
Except for the 3 nerve pain meds that I take, like Lyrica.
That's what I take. Yep.
Celebrex, and there's one other that I can't think of.
Okay.
I take 3 different nerve pain meds, and I didn't think they did anything. I was like, I need the narcotics. I don't. And I have an addictive personality, so I don't need that. And then I ran out because my insurance fucks me every month. They only pay for like 20 to 25 days. Can you hear me now?
There you are. All right, now I can hear you.
So my insurance, they only pay for like 25 days of my nerve pain meds, which the last 5 days, I really need that shit. I can't just stop taking it for 5 days.
Exactly.
And when you do,
you feel it.
Shit doesn't hurt.
You feel it.
I didn't think they did much. They do.
They do.
They do a lot.
And my first neurologist that I was appointed to out of the hospital, he put me on Lyrica, and it was August 2021, and I was put on the Lyrica, and then November of that same year, I was having problems with my hands. Like I couldn't open things. I just didn't have and it sounds so silly. Like for a while, like I didn't have an appetite, so I would eat something like little just to take with my medication, because all the medication I took would screw up my stomach. And so I'm like, I'll get applesauce. And I couldn't even open the peel on the applesauce. And I remember my mother-in-law, she came over and she would like kind of prop them up a little bit. And because she saw me doing it, and I'm like, I just take it for that reason. And so when I was having the side effects with my my hands, they thought it was the Lyrica. So, lo and behold, they put me slowly off of Lyrica, and I couldn't move. I was stuck in bed. I just remember sitting and like, if I had to move my arms up or get my body up, it was just like an ordeal.
Excruciating, right? Like I was in the fetal position just crying when I ran out of my Lyrica. I was horrible. I was in so much pain.
And like you said, it's expensive. And I couldn't believe this month. So we just picked up a dose of Lyrica because the neurologist and physiatrist, I don't know if you've heard of a physiatrist. Okay.
No,
I'm
not familiar with that.
Definitely get back to that, because that is something I really want you to know about. But he just recently, I was on 150 milligrams of Lyrica twice a day, and he just put it down to 75. And when we went to pick it up, it was $77. And, for me, I'm like, thank God, we have an HSA account, and, we can pay for that. Because otherwise, I'm like, what would I do? There's no coupons. There's nothing, they say GoodRx and all this stuff. I'm like, GoodRx, they don't even have Lyrica on there. And
I tried that too.
It's like, what would I do if I couldn't afford this? Like, I would just be stuck and not able to move, and I have no, good.
I would go right back to the ER. I would have
Right,
to. I would be in so much
right.
pain that you can't do anything.
Absolutely. And
Like even,
yeah, and I was gonna
yeah,
say,
yeah. Go
go
ahead. I'm
sorry,
sorry.
from the 150 to the 75, I can feel that. I can feel that right
Yeah, I
away.
bet.
And I'm slowly like I'm trying not to think about it and let it overcome my mind, but like I'm just like, all right, instead of taking two of the 75s, because I started off with that, I'm like, let's slowly, I'm like, I'm gonna do in the morning two 75 milligram pills and then do a 175 at night. And then slowly
Hmm.
try to get out
Hmm.
of it because I'm just like, this is expensive. I don't know what else to do, but I can't.
And you can't not have it.
Exactly.
So
Exactly.
I take 225 3 times a day, and it's like the max
Yep. That's what
dosage.
I was on for a while.
And I learned quickly that, like I said, when I ran out, I was in big
Yeah.
trouble. So my wife was the one. My wife Summer was like, "Babe, you got to do like try to skip your afternoon one
Yeah.
and just take one in the morning and one at night. So those extra 5 days that you're out, you're
Yeah.
good, and you don't have to deal with
Yep.
this. So that's what I do now, and that's what I've had to do to kind of adapt and overcome that situation.
Yeah.
Because I just
It,
can't go from that to
right.
nothing.
It's almost like you have to like hoard it because just in
Yeah,
preparation of something happening, God forbid, like us, we just had a horrible, I can't even talk, horrible
yeah,
snowstorm, not a horn storm. And
yeah,
there
yeah.
was
I
a lot of
understand.
stuff that was closed. And I was like, thank God, like I was given hydrocodone, and
Yeah, same.
hydrocodone is the only thing that really gets me moving. I don't want to say it makes me feel
Right.
100%, but I'd give it like 60%, that it gets me going
Yeah.
and, makes me not feel as bad. But, I'm like, thank God I had everything and had enough of it because one, I mean, my doctor mails my scripts to me and because he's in New York City and
That's cool.
yeah,
Yeah, that's not an
and
option here.
yeah,
They
and
won't.
New York City, I mean, I'm like, okay, our
Hang
mail,
on, hang on
oh, go
one
ahead,
sec. Just yeah, yeah. Just give me one
go
one
ahead.
second there.
Oh, there you are.
Hang on one second. Are you taking your car today?
Yeah,
Are you? When are you leaving?
right now.
When are you coming back?
I don't know.
Will you be back before 4 o'clock?
Yeah, I have dinner
Okay.
with dad at 4.
You what?
I have dinner with my dad at 4.
Okay, perfect. I can take it then. Say close at 5.
Okay, perfect.
Yep. Good deal. Yeah. Sort out my daughter's car because we're taking her back to college, her first year of
Oh,
college in Arizona
oh,
tomorrow.
wow. Jeez, congrats.
So I want to make sure her car's thank you, but her car's good to go before she takes
Oh,
it
nice.
back there.
So what I will share with you, real quick, because I guarantee you and I could go on and on. I mean, with all
Oh
the
yeah,
shit that we've
forever.
been dealing with. I will say after all of the neurologists I went through, I mean, I had one that, and I wish I was kidding. Like, I wish I'm like far-fetched talking about this, but he literally, I saw him for less than a month. He told me, he kind of like gave me a sense of hope and it was
Hmm.
fake and it was like come to me, like I could tell you, you go in his office and it's like this huge gorgeous office and he has everything and he's like, I'm gonna help you, I'm gonna cure you. And I felt straight head first into the trap, and I was like, oh my God. And I remember I got into the car with my mother-in-law and just started bawling my eyes out because I thought, oh my gosh, this guy's gonna help me. Like he cares, he's concerned. And it turned out he ended up realizing how much of a, what's the word I'm looking for? like I'm basically not a patient that a risk. I'm a risk for him. Because of
Yeah.
the things that I need to be on. And he just all of a sudden didn't want to deal with it. And he was a part of me getting the second IVIG, which I found out really didn't do anything for me. And,
Mm-hmm.
it ended up I got a letter in the mail. And, I just had recently talked to him about medication because I was trying to wean off of the
Yeah.
Lyrica and the hydrocodone. I mean, he only gave me like 5 milligrams. And I asked him if it was okay for me to take 2 pills at night instead of taking
Yeah.
two, one in the morning, one at night. And for him, he
Yeah.
was like, okay, well, she's not taking the medication like I told her to. So I don't want anything to do with
Mm-hmm.
her. So
Yeah, exactly.
and the letter, said my birthday on it, that they were dropping me as a patient. And I couldn't believe it. I'm like, I just spoke to these people. Like they couldn't
I
even say
can't
it to me.
even. I didn't know that was a
Yeah.
thing. That's crazy.
And I actually, at the time it was so much was going on in my life. So it was like, I didn't even have the energy to really go after, Better
Oh
Business
yeah.
Bureau, because that was so hurtful to me and so painful, because I'm like, I talked to these people and they didn't even have the guts to like tell me that they weren't happy that I wasn't taking the medication correctly. And, it was like,
Oh
okay, I'm
yeah.
like, my other doctor told me that was okay. And like, if you don't feel well, take your pills, take two, So yeah, I'm like
Yeah. I fight with my doctors all the time about my medicine. I understand
right. And so for me
completely.
it was like,
I
what the
get it.
heck? But really fast forwarding, just in July of last year, I was fed up. I was so frustrated. I found another neurologist that wasn't willing to help me. He was the one that told me, if you're not better by January of 2023, you're living with this for the rest of your life. And that just wasn't enough for me. So I went online,
Mm-hmm.
I searched, and right away, this neurologist, it said neurologist and physiatrist. And trust me, it took me very long to be able to say that name. And he did telemed, so he did stuff over the phone. And it said that he's very good with like pain management and trying to just get you to have a better quality of life. and
Yeah, for
and
sure.
that's what I was looking for. I'm like, there's so many pain management places around us, but there were people that didn't want to help me. There were people that they weren't accepting
Yeah.
new patients. And I was just like, okay, my primary is suggesting me to go to pain management because she doesn't want to risk her license, giving me any kind of pain meds. And nobody wanted me. So I'm like, okay, I got to
Yeah.
figure it out. So I found him, and the next day we had a phone call, and immediately he, like, just talking to him on the phone, I couldn't believe that I could understand how much he wanted to help. And I asked him, what is a physiatrist? And he said it's somebody that specializes in neurology and physical therapy. And I was like, sold. I'm like, okay, I need
Yep.
somebody that's worried about my movement as well as neurology, the actual nerves and stuff. And he, like, from there on, every day, like, if I needed to call him right now, I could get a hold of him. Any of my neurologists,
That's
yeah,
amazing.
any of the ones
What
around here,
a difference that kind of care makes in you moving forward, you taking another step.
million,
It's huge.
million times percent. And, it's like this person is out of New York City. That's 8 hours away from me. And he was able to help me better than 3 other neurologists that are about 5 miles from me. And it was just because he listened. He said, let's take a step back. Let's not think about GBS.
Yeah.
Let's think about your spine. Let's think about your back. Let's think about what's controlling your knees, your feet, your legs,
Yeah,
and
absolutely.
and I was like, oh my God. And I tell him all the time, you're amazing. Thank you. And I've gone to see him in New York City twice, and have gotten steroid injections in my
Mm-hmm.
back. And, I could tell everybody that was with him loved working with him. They called it his name is Dr. Gupta, and they would call it Gupta Mondays, at their facility, because everybody was there to see him. And he was just so like meeting him in person. I never thought that I could meet somebody in person and like them even more than I did over the phone. I was waiting to be like, all
Yeah.
right, maybe he's not that good, and he's just all talk on the phone. And he was just so amazing. And like, he had about 20 different patients when I was there, and he took the time to ride the elevator with me, roll me out, and just meet my husband to shake his hand. And that meant the world to me, that he was that committed to helping, and that he even told me, don't thank me until you're better. And that, like,
It's
yeah,
nice that you find somebody that's not just writing a script and telling you to wait and
yes,
watch.
you're not a number.
That actually looks you in the eye and speaks to you like a human being.
Yeah.
Because I've had plenty of those other doctors. One that I'm just like, listen, homie, just check your ego at the door. I don't care about your schooling. I'm a human being. And like that I just won't even deal with anymore. And then I've had others that are like, we're just going to wait and watch and see what happens. And here's the script. I don't want that. I want exactly what you're talking about. Like, somebody that can look you in the eye and tell you, I don't know all the answers, but we're going to work on it together.
Yeah. And,
that's what I'm
that's what we all
for.
need, and like I said, I don't want to feel like a number. I don't want to feel like a check mark of, okay, we did this, and this. All right, well, she's not better. We don't know what else to do. So good luck, and for him, it's like, he's like, let's try this route. Like, how are you feeling now? Like, give it a couple days. And, and with him, I my husband always asks me, like, do you feel like those injections did anything for you? And I said, it's not an immediate, it's not like, that first gratification that you're going to feel like that much better, but slowly over time, I was feeling better. And I noticed that. And I noticed my movement was a lot better. And, and it's all to him. And just the way that he is so dedicated to just, it's like this person, I'm trying to, it's like the best way to put it, it's like this person is meant to be a doctor and was put here to be a doctor. And, there's nothing else that he could possibly do that would give him that gratification. Like his life is based on making his people better and have a better quality of life. And
that's awesome. I'm really glad you found that. That's amazing.
I tell everybody, because I mean, even for you being, across the country, he would help you. He would, if you want to get his name, I'll give you his information. I mean, you could literally, I give you his number, call him up. If he has an answer, he'll call you back in 5 minutes. And he just like he'll talk to you for over an hour and want to know, like, what's this, what else happened? Let's target this, what are your doctors doing to help you there? And, it's just been such a blessing and so godsend for me, because if I didn't have him, I would be in that state of mind still of like, I just don't know what to do. And, like, I think.
And that's a terrible feeling.
To leave a doctor's office and go, why did I just come here, is the worst feeling in the world.
Yeah. I just wasted a copay and I don't know any more information. I don't feel any better at all.
And that's how it is. Like, and I love my primary. She is an amazing doctor, but she is not a doctor that has been she's not experienced with what we have. And so she's just going by like, whatever the book says. And, and I totally get it, but it's still like when I leave there, I don't feel better. I don't feel like I accomplished anything. And, I'm like, I'm paying all this money just to be like, great. She's there to refer me, write out a script, write out a referral so I can go and get things done. But that's it. And so he has been absolutely wonderful. And I have actually a telemed appointment with him next week, which funny enough, yesterday he messaged me and said, hey, he's like, is it today or is it next week? And, it was just to have that bond, I'm like, it's next week, don't worry.
It's nice to have that. He's still a human.
He is such a human. And it's funny to say he's such a human, but he is just such a loving human being, and I know he, at the same time, it's like, he's going through stuff. He's got a father that is dealing with liver cancer. He just had a baby in October. So it's like, for this person to be so like focused and good at their
Yeah.
job and not let those type of things change him in any way.
Sure. And still deal with his other stuff, his home stuff.
And that's why I always make excuses for other doctors, like, who knows what's going on in their life, and this and that. It's like, no, here's this person that has two life-changing things happening, and he still wants to help his patients.
Yeah.
And so
that's amazing.
That's really, the most I can think of to share with you today. There's just so much, and I know you can say the same thing. There's so many things that both of us are forgetting to tell each other. And, it's just because we forget, until it's like when I'm telling you about my leg surgery that I had, I forget about that even happening. I'm like, did that happen in August, or was that September? Did I go 3 times in one? And like, it always like just disappears, because it's like, there was just so much happening in that hospital and after the hospital, and still is,
Yeah. So there's one more thing I want to share with you, Sarah, and that's just real quick. And then I know you got to get back to life, and I got to get back to doing things. But this has been really awesome, and I appreciate you coming on here and just talking to me.
Absolutely.
And same with that support group that we were just on, that coffee chat. But as far as you mentioning the memory part of it, having that GBS brain and that fog of forgetting constantly.
Is the
one
perfect
thing
word.
I do is I write things down a lot. I have this little book next to me, and I write them down, and just because it helps me go back, or I'll text my wife something, because I know I'll forget it. So I have that, that way to get back to it. It's like archiving an email or something.
Mm-hmm.
But another thing that I'm doing is, I'm writing a book on my experience.
That's awesome.
For 2 reasons. One, like I said, I came out angry. I came out of the hospital angry. And I need to get it. I have to get it out, because I wake up nightmares that I'm still locked in, that I'm still in the hospital. I'm still
make me tear up again.
In this hell. And it happens. And like, it's really good for me to like just type it out on the computer screen now that I can use my fingers again. And so I'm doing that. And for me, and 2, if I can reach anyone else, then it's worth it for me. And that's why I'm trying to do this. I'm trying to do anything I can physically do to help somebody else, even if that means just listening. Listening on these support.
Yes, and to go back to the coffee chat support room, this was only the second one that I was on. And the first one, the reason I actually decided to go on another one was because there was a woman, she wasn't on today, but it was her and her husband. And she was trying to talk to the host that was on today about one of the symposiums that they had. And she said, she was like, I think the girl she was referring to was Mary, but she was like, Mary, what are those things called? The things that were there, and we were there, and like right there, I just like locked in and felt like her pain. And she just like, I could feel the pain of her just trying to figure out what she was trying to say. And then Mary just said, are you referring to the vendors? And she goes, vendors, that's the word. And she said, I'm so sorry, that's my GBS brain. And it just like, whoa. And it stopped me right in my tracks. And, I spoke up and I said, thank you for saying that, because I thought it was just me, and maybe my medication or something was making me to forget everything. I'm like, I could literally walk in another room and forget why I was in that room. And I was like, yes.
Absolutely.
And I'm like, thank you for saying GBS brain. And then one of the other hosts said, yeah, that is real. It's a real thing. It affects your brain. And I was just like, whoa, holy, shit. And I mean, that was just in December. And I'm like, why haven't I been going on these? And I felt like, holy crap, like there's these other people that are teaching me about me, that I don't even realize that I'm
Absolutely,
not going
right?
crazy. It's literally a thing. And, that word, when she was really trying, I'm like, I get like that. And it's so frustrating. And you just like, you don't know what to do. And for you, I think it's amazing that
Yeah.
you're writing a book. And what you're doing, everything that it feels like you're doing it quicker than I am. Because like I started writing as well. And, I thought like,
Mhm.
I need to put this down somewhere because it's hard to talk to some people about it because they don't understand.
Yeah.
It's hard to talk to your loved ones about it because yeah, they might see that you're doing better, but you're not feeling good. You know,
Yeah, if you're
you
not
still
feeling better.
feel
In
like
here,
shit.
it gets a little dark in there,
Exactly.
and that's like going back to that thing that we talked about. Like you don't get the answers by talking to a
No,
doctor.
not at all. Absolutely not.
You get the answers by talking to somebody who went through it or is going through it. For this thing that we have, or at least my variant or version of it, is lifelong. It's
Yeah.
not. I get a treatment once and go home and
Yeah.
work on myself.
Yeah.
It's just not. It's this.
Yeah.
This is life
It
now
is.
for
And I
me.
think that, and I always try to like put myself in other people's shoes. And I think a lot of people that don't understand, and oh my gosh, I'm having GBS brain right now. I'm like, what was I just saying? Um,
It
oh,
happens all day.
I got
Don't
it.
worry
It's
about it.
just back. That they see it as okay. She has this illness, or I'll say we have this illness, and we're living with it. And then they're kind of like, it's almost like 8 months later, they're like, okay, treating it almost like you got a broken knee or something. Where there's a deadline
Hmm.
where it's going to be better in 8 months, 8 weeks, or whatever. 6 months, and it's like now they see you, but you're like, I'm not that much better. I'm still like walking with a
Yeah.
waddle, or I got a cane that I have to have. I can't do stairs. It's like just because you can physically see, like, I'm not in a hospital bed, it doesn't mean that you're okay. And it's very hard to
Right.
explain that to somebody that's not experiencing the same thing.
Yeah. Yeah. You're
Yeah,
absolutely right.
that's my
It's.
rant.
I get it. Like I get
Yeah,
it. I'm not better. I'm sitting here instead of laying in my hospital bed in the
yeah,
downstairs, but I'm not fixed,
yeah.
and I don't know when that's gonna be. But doing things like this it helps me to talk about it with other
Me
people,
too.
and so I'm here anytime. You
Thank
can
you.
you can hit me
No,
up,
I really
and
appreciate
we can
all of
do
this.
more of these. We can add some more people in
Yeah,
here and get some more stories, and just help other people while we're helping ourselves. And I think that's the hot ticket. It's I'm trying to let go of the anger, and I'm just trying to be kind and help a stranger out,
yeah.
or whatever I can do. And I think that's what it's
And
all about.
I
So
know that it's coming up on a year um for you, and I'm just, this is just a suggestion. And I mean, you're gonna do what's best for you. And so when I had my 1 year of being in the hospital back in August of 2022, yeah, right, I'm like, what year are we in? We actually had a party, and because it was coming up, and it was very depressing. And I was, like you said, getting angry, and I was mad that I'm like, here we are in a year later and I'm still not fully recovered. And then I really had to step back and say, you know what, why don't I just be grateful that I'm able to walk, I'm able to talk, I'm able to use the bathroom on my own, I'm able to, even though
yeah,
I have to use a chair in the shower, I can take a shower on my own. Like, I
yeah,
couldn't do that. And so for me, I asked my husband, I go, you know what? I kind of want to celebrate that I'm here. I go, things could have been a lot worse. And it made
yeah,
me feel good having, the people that I did have that have been supporting me, come in and just to be here and say like, hey, we're happy that you're here. We're happy that you're still alive. We're,
Yeah.
happy that you're able
Yeah,
to
that's a
walk.
great idea.
So, I mean, for whatever would make you happy, even if you can have a cake and blow out a candle, it's just,
Yeah,
it's something to take the good out of bad, out of something that makes us
absolutely.
so
Yeah, that's a
pissed
great
that it
idea.
happened to us and why me and stuff. It's kind of like, all right,
Can you hear
let's
me okay?
actually
You cut out for a
enjoy it and
second.
have a celebration.
There you go. I got you back again.
Oh, yeah, I know.
Yeah, that's a really good
Sorry, you're
idea.
breaking up on me too. Hang on, maybe if I
Cutting
move.
in and out. Well,
Oh, you're still frozen.
I'm absolutely gonna
Yeah.
do that. Thank you so much for your time, Sarah. I
You're
appreciate
welcome.
you. I appreciate you sharing your story with me and you letting me do the
Yes.
same. That's really
Yeah,
awesome.
and thank you. I thank you for doing this as well. And if you would like to have me on, I am more than willing to come on. And I mean, I'm alone most of the time, so I can talk your ear off. Trust me. um,
I'd be more than happy to have you on again. And like I said, maybe we can get a couple other people that are in a bad place, and show them that even though you're in a bad place, you can get some positive out of it.
absolutely.
And we could still live our lives. We just do it a little differently than we used to.
Absolutely. You got it.
You know.
Well, thank you so much. And I will definitely be in
Oh, you're
contact soon.
very welcome.
Thank you. You take care.
For sure. Have a
Bye.
good day.